Alexandra Vacroux. I'm the Executive Director of the Davis Center for Russian and Eurasian Studies, and I'm thrilled to lead a discussion today on the medical and public health and political impact of coronavirus in Russia. I have two distinguished guests with me today. I'm going to introduce them, and then we'll have a few opening statements and move right on to Q&A. First, we have Joshua Yaffa. He's the Moscow correspondent for The New Yorker. He's reported from Russia also for Bloomberg, Businessweek, The Economist, National Geographic, The New Republic, and The New York Times Magazine. He's also out with his first book called Between Two Fires, Truth, Ambition, and Compromise in Putin's Russia, which was published in January. Salmaan Keshavjee is a professor at the Department of Global Health and Social Medicine and the Department of Medicine at the Harvard Medical School. He's also director of the Harvard Medical School's Center for Global Health Delivery in Dubai. He serves as a physician in the Division of Global Health Equity at the Brigham and Women's Hospital, and has also worked with the Division of Global Health Equity and the Boston-based nonprofit Partners in Health on the implementation of a multi-drug resistant tuberculosis treatment program in Tomsk, Russia. Dr. Keshavjee is an affiliate and executive committee member at Harvard's Davis Center for Russian and Eurasian Studies. So Josh, I want to start with you. You are on the ground in Moscow. You're observing this up close. Could you tell us what the state of play is at the moment?
Sure. The state of play is that things are changing fast and not necessarily in the most positive direction. I was just looking back actually at the last time I wrote something on Russia and coronavirus for The New Yorker about 10 days ago. And the theme of the piece was trying to get at the mystery of why is the coronavirus epidemic within Russia seemingly either proceeding slower or with less reach than it is or it was at the time in other European countries. And Russia certainly was behind places like Italy, Spain, Germany, UK. But it now seems like rather than avoiding the worst of the coronavirus outbreak here in Russia, it's rather going to come, but just kind of come on a bit of a delay. So when I wrote this story 10 days ago, there was just under 500 cases. Today alone, there was a jump of about 2,800 cases one day, the biggest one-day increase so far, bringing the total to about 18,000, just under 20,000. And Putin himself is now speaking in ways that are worrying, or at least rather acknowledge the seriousness of the situation, that in fact could even get worse. And I think that's particularly striking because Putin and leaders like Putin tend to put as much of a kind of positive rose-colored spin on things as they can to make themselves and their systems and regimes look as successful and powerful and competent as possible. So the fact that Putin yesterday in a televised meeting said that the situation is quite serious, the next couple of weeks will be quite decisive, things are proceeding not on the most positive scenario, and the country has to be prepared for all of them. And in fact, the country's health system has nothing to boast about, which was quite a surprising statement from a president who's been in power for 20 years. Who's had plenty of time to do something about that public health system. So that struck me and other journalists and Russia watchers here as to see that kind of admission or acknowledgement of the situation from Putin suggests that there really is that the government, the Kremlin, is quite worried about the situation. I mean, the situation is indeed serious, and we see it in the numbers. We see it in the reports of lines for hours, up to 15 hours. In fact, this weekend were some reports of ambulances to drop off patients at Moscow hospitals. The Moscow Health Department said that hospital beds in the city could run out in the next couple weeks. So we're getting all of this anecdotal information matched up with now official statements that suggest the situation, rather than as one hypothesis had it a couple weeks ago, that maybe Russia, for various reasons we can get into, it seemed like might be spared. The worst of this actually is now bearing down on the eye of the storm. With a bit of a delay from the rest of Europe, but nonetheless heading into what is likely to be a rather difficult and trying time.
Thanks, Josh. Salmaan, let me turn to you. Given the direct experience, the decades that you have working with healthcare providers across Russia, both in urban areas and more rural areas, what do you think about how Russia has been reacting, and what are you looking for in terms of understanding how the pandemic is going to hit Russia's healthcare system?
Well, the Russian healthcare system is interesting because, as we know, they've got very good reach into communities. And That's changed a little bit in the last 10 to 15 years, but the system was built to be able to screen in the community. So I've spent all these years working on tuberculosis, which, like coronavirus, is airborne. Like coronavirus, lives in communities and is passed, from in families and in the places that people work. And once the epidemic is out of like a very narrow group of people, you have to figure out where your clusters are and do population-wide testing. And the Russians have been amazing at doing that for TB. Now, after the Soviet Union collapsed, there was a period where they were advised by people not to do these kind of community-based interventions. But then in the early 2000s, they restarted. And, in places where we're working now, like in Vladimir and Voronezh, people are still doing X-ray screening in communities that have a high burden of TB. So they have the capacity to do screening and get to the community where patients live and work, which I don't think a lot of health systems can do. Certainly, we're not able to do that in the United States. So I think that that's one piece of it. The other piece that they have in place is that they, this is a critique of them and yet also a strength in this type of thing, is they have a cadre of people that will work on infectious diseases and focus down, drill down from the specialized hospitals into the community. And so if they do that right, I think that, they will be able to do the amount of testing that's needed. Look at what they've achieved. They've done 1.4 million tests in a country of 140 million people. That is proportionally a little bit more than what the United States has done, and much more than other countries. So, if those numbers are in fact accurate, then, and again, we don't know the quality of the test, we don't know many variables, but they've actually tried to test a lot of people, and I think that tells you the community reach. Now, like the US, every oblast is different. And they have their own rules and their own laws, and different oblasts. Like I was talking to some colleagues yesterday in Moscow, and they were saying, yeah, some oblasts have a 14-day quarantine rule if you visit, some don't. And so, they've got, I think they're hampered in the same way that many countries are, and certainly the United States is, by kind of a hodgepodge of different things happening in different places. And the other thing that I think hampers their response, again, in the same way as what you're seeing in the United States or in the UK or in Canada, is that people don't know the true prevalence in the community. You need to do a community-based survey. You either need to test everybody or do some sort of, cluster randomized survey in a community to figure out what's going on. And so when we look at Russia, there's Moscow and there's, 80 other places. And in a way, it's 80 maps, and you kind of need to know what's happening in each of those situations, because they may require slightly different responses. And so, if I were to critique any country's response to this, it would be, are you drilling down to, do you know your epidemic? Are you drilling down enough to make the right decisions as to, which places should be more locked down than others? Where it is, who you should be assisting, etc. But I think the Russians have a lot of strengths in doing a lot of the things that we've talked about. I would ask Josh, you're there, Josh, on the ground. I mean, are you seeing testing? I mean, I know you're in Moscow, so that's kind of like the epicenter of this. But are you seeing massive testing or testing centers and the ability of people to get tested if they need to? Like, are you seeing what I'm describing as a possibility of health system?
In Moscow, yes. I mean, it's not to the point you don't see the kind of drive-through test centers you've seen in some countries. South Korea being the kind of now gold standard for mass testing. Israel, as far as I understand, you can kind of just walk up to one of many or drive up to one of many mobile testing centers and get your result by SMS the next day. There isn't quite that. It's not in my walk around the neighborhood or walk to the grocery store. It's not like I have the opportunity to take a test if I wanted to. But that said, talking to, for example, family in California, if I were to want to take a test, that option is available to me in ways that it's simply not to family in California who don't meet the stringent US testing criteria. There are a number of private clinics in at least Moscow that are authorized to do coronavirus testing and have been doing it now for a couple of weeks. And so if you are willing to pay, the range varies, but relatively inexpensive, at least in dollar terms, anywhere from about $30 to $60 or $70, you can do a test on demand. So there is on-demand testing, at least in Moscow, and people are taking advantage of that. of course, once you get out into the regions, as you know well, a lot about healthcare changes, sometimes very dramatically, depending on the region. And so there it's much spottier. You also have people with simply less disposable income. So if a lot of Muscovites, for peace of mind, or because I know one person who wanted to spend time with his parents who were in a potential, risk group because of age, paid to take the test to then be sure that he could, go over to the apartment safely and bring them food and things. You just perhaps in the regions have people who also, for financial reasons, are less able to kind of allow themselves that peace of mind. One thing that is worrying and kind of discouraging to see in Russia, and I don't know what you may have heard from colleagues, Salmaan, or can just add to this from your own experience in Russian hospitals, but Russian hospitals do seem to be one of the primary vectors, especially outside of Moscow, for spreading the disease. And that's tragic simply because people who are already, that means healthcare workers are getting infected, and people who already maybe are sick with other illnesses are getting infected, so they already have compromised immune systems. But it's also especially tragic because that's a lesson the world has seen in places like Italy, where the hospitals became one of the primary vectors for spreading disease. So one of the regions, it might even be the third region after Moscow and St. Petersburg with the highest number of cases, Komi in the north toward the Arctic Circle. That local epidemic really did come out of hospitals, and a number of hospitals have been shut down, and you've had dozens of medical workers infected, not to mention patients. So it's perhaps unavoidable, right, that may happen in the region simply because there isn't the ability to create kind of standalone coronavirus hospitals in some of the regions, especially certainly not in smaller rural areas like you have in Moscow. Every day in Moscow, I feel like I'm seeing the news that another hospital that had functioned for many years for some other purpose to accept another kind of category of patients has been now kind of reformatted as a coronavirus hospital. And so you have these dedicated health facilities in Moscow that treat only coronavirus patients, but the regions, for reasons of just logistic, economics, resources, can't do that. And so in places like Komi, especially, but elsewhere around Russia, the hospitals are becoming a vector for spreading it. One fact that we talked about just before this meeting began, and I wonder if you would care to comment on it, Salmaan, and tell me if this hypothesis is correct, is that the average age, at least in Moscow, of those who have been diagnosed with coronavirus is quite young. I think it's about half the patients are under 45. I could be getting the exact statistic wrong, but that vaguely is the number. So you have a large number of patients at a relatively young age. And to me and to other journalists and analysts I've spoken to, that's a sign of a good and robust testing program. It's not that in Russia, younger people are somehow, for some reason, more predisposed to get the disease. It's simply that means the testing program is catching younger people who may not be sick or maybe not even symptomatic, whereas in other places, say like Italy, they were testing largely at arrival at the hospital. So they were getting older people who were appearing with more serious symptoms. So perhaps that's actually a positive sign, like it is in Germany and Iceland, I understand, where they have a relatively young average age of patient. Maybe that should be a kind of hopeful sign for Russia, or at least for Moscow.
Well, Josh, you brought up so many good points here. Russia's population is younger, and younger people will fare better, right? And Italy, unfortunately, for them, their general population is so much older, and so you run into a situation where once it spreads in the population, you will have more death because you're dealing with older people. Younger people will get it, and it appears, though they do end up sometimes being in hospital, their mortality is much less. So I think that's really important. And the fact that Russia has actually screened so many people and is continuing to do so, you're right. Like, it's a good sign. They're actually getting out into the general population. They're finding people that that may not need hospital care. So I think that whole screening axis is very good. The point that you've raised about hospital transmission is really critical, because when we did a study in Tomsk some years ago to look at TB transmission, and everyone said, the World Health Organization told us the biggest risk factor for getting TB was not taking your medicines. And so we put that to a test. We did a big study on this, and it turned out that the biggest test for getting TB, drug-resistant TB, was being hospitalized. And it was because the hospitals were a place that there was a lot of transmission, and it makes a lot of sense. And when we look back at the data, the US CDC had discovered this in 1990, 91, 92 in Miami and San Francisco and New York. So this was not some earth-shattering finding that hospitals are a place where you transmit. And so, we spent a lot of time doing interventions in hospitals, including putting indirect UVC lighting that faces the ceiling and reflects down and kills bacteria and viruses, and a variety of other things to ameliorate the situation. And I would say ameliorate it successfully. In Voronezh, we actually brought down hospital-based transmission by about 92%. So it was remarkable. You can do it, and Russia actually has the experience to do it. The data from Wuhan, especially the early studies, showed that they estimated up to 40% of the early cases were due to people coming to the hospital for another reason and getting COVID. Mm-hmm. So, the idea of having separate COVID hospitals is not a bad one, number one. Russia has the technology and capacity and experience with putting indirect upper room UVC lighting into prisons and hospitals, and could expand it. I don't think they have, and we certainly haven't done it here, if you can imagine that, even though we've also had that experience since the late 80s in New York. So that could also help ameliorate the situation. The other thing that ameliorates the situation, which neither Russia nor the US nor many other countries can do, is keep people who don't need to be in the hospital out of the hospital, right? Like if you have good ambulatory delivery systems with nursing, you could actually keep people in the communities where they live, right? Like the majority of the cases. And so, there's a number, the hospital is a place that you don't want to go to if you don't need to, and hospitals that are separate, because one of the things we're looking at right now, what's happened to all the people with appendicitis and with diabetes and with thyroid problems and with cancers that need to be diagnosed? Like if we see an uptick in mortality in the world following coronavirus, all of it will not be due to coronavirus, right? It'll be due to depression and suicide and cancer and a number of other things that are, that happen when you don't give people care for a variety of other things. So, Russia has got experience, I think, in the specialized hospital system, which usually is not a good thing, but in this case would allow somebody to be able to go to a cardiology hospital or some other hospital and get the care that they need for their other things. And of course, with the robust testing, you could make sure that those facilities are safe with UV lights, with personal protective equipment, et cetera. So in that sense, Russia is very well suited for that.
Actually, I want to follow up on this question of PPE, Salmaan. Sorry to cut you off. I don't know if in your conversations with people in Moscow, or Josh, in your conversations, do you have a sense for whether there's a shortage of necessary PPE and other medical equipment in the Russian hospitals?
In the regions, absolutely. That seems to be, and again, that's compiled from anecdotal reports, though. I mean, I guess here all you really could go on is anecdotal reports, what you hear from this or that hospital. There really aren't kind of, national level surveys or statistics available on this question. So what we can do is just follow the reports of doctors, nurses, and other medical personnel from hospitals coming out and saying, we don't have the equipment we need. And that's a pretty widespread phenomenon, especially in the regions, right? And like Salmaan knows better than I do, in fact, about the discrepancy between healthcare available in Moscow, St. Petersburg, maybe one or two other cities, and in the medium and small towns, that drop off can be really dramatic. And in fact, one thing that's happened over the past years, and I don't know if Salmaan you've had experience with this, but there's been a program of so-called optimization, which actually is a kind of Orwellian doublespeak term to mean the bureaucratic downsizing and elimination of some hospitals in small towns and rural regions. So in fact, rural Russia was less equipped than ever going into this epidemic, because it had actually lost healthcare facilities due to this bureaucratic reorganization program in recent years. But there are some NGOs and volunteer organizations that are trying to deliver personal protective equipment to doctors and medical personnel in the regions. Quite tellingly, perhaps depressingly, unsurprisingly, some of these groups have run into problems with the police and local bureaucrats who don't like independent organizations getting involved and bringing to light some of these problems and really doing an end run around the bureaucracy, which is the Russian bureaucracy never likes that when kind of individual private initiative takes over or sort of does what the government can't. So anecdotally, it seems like there's enough stories of enough hospitals and enough medical personnel saying they don't have what they need for it to seem like that really is there's enough smoke for there to be a fire there, in my estimation.
Josh, I hate to keep coming back to the situation in the U.S. as if it's the only comparator, but in the post-Soviet period, the health system in Russia really was transformed with Western advice into what we have here, right? Which is, I mean, not fully, obviously, but there was a push to have this, these hospitals with very few beds, with just-in-time stocking, and all of these kinds of things that we have here in the United States, right? And we're facing this exact same problem. That that there's shortages of PPE, people are reusing things, and at the hospital, like the hospitals in Massachusetts, in Boston, these are the top hospitals maybe in the world. There's been 500 plus people infected because of they've not sometimes they haven't had the right equipment. So you're starting to look at this and say, okay, Russia, the things that we're seeing in Russia, how much of it is because of Russia, and how much of it is because of the push to cut back on investments in the health and education sector, for which we are also party, Russia's party. The whole global economy has moved in that direction. And so you have a curtailing of services for people. And I remember our arguments, people said, you got to cut hospital beds for TB. Other countries don't have it. Okay, I mean, who can disagree with that, right? But then at the same time, where will these people go? Are there enough homeless shelters? Are there food stocks? It's minus 40 outside in the winter. The hospital serves a social purpose. So there's a lot of pieces to this. But when you had economists coming in, they're like, well, you have X number of beds, per person, and other countries have 5 times less, and you need to cut it. And so I think part of what we're seeing in Russia may be a product of our own making. And it's not that the Russians didn't agree to it. People agreed to it. But I see it more as neoliberalism coming back to haunt us more than the Russians having a badly organized health system, because we thought ours was very well organized. Mm-hmm. We thought that we could deal with epidemics in this country. We thought that New York was ready for all sorts of bad things that could happen, and it turns out we were wrong.
Sure, I wouldn't.
Mm-hmm. I was just going to say, doesn't some of that have to do also with the way that people were looking at the evolution of, what is it that actually kills people, right? That the Russian system, the Soviet system, was set up primarily to deal with epidemics, so they had a lot of beds. And then over time, there's been a push instead to deal with preventative care for chronic diseases, diabetes, cardiovascular disease, and those things. And so are you saying that transition should not have happened, that we should be keeping kind of the latent resources to fight epidemics and not shifting more to preventative care, assuming you have to make a choice, right, between where you focus your resources?
Yeah, Alexandra, this is a good question. I think that neither the U.S. nor Russia has dealt like you're saying that there's been a transition away from epidemics to dealing with chronic diseases, and I wonder if that has actually even happened, because chronic diseases actually require very, very good community outreach into the places where people live and work, testing and treatment, because people with diabetes or autoimmune disorders, whatever, don't live in hospitals. People with high blood pressure don't live in hospitals, right? So theoretically, I would argue we haven't made the transition anywhere. There's places that are trying. The NHS, the Dutch health system, parts of Canada have tried to do better community integration of care. But I would say that with the focus on hospitals in the United States, the focus on hospitals in Russia, we have not succeeded. So what we've seen is a cutback of hospital beds as part of cost savings, because hospitals are expensive, without the concurrent building of an ambulatory system capable of testing and treating people in the community. And if we had that, if Russia had that, if the United States had that, then screening people for COVID would be relatively easy. I mean, you'd need the tests, of course, and the supply chain, but it would be relatively easy. Think about this. We're talking about a few million people maybe eventually getting COVID in the world. There are 350 million people with diabetes right now. 2040, it's going to be 700 million. if they're not tested and treated, they're going to go blind, have renal failure, get pneumonias, and have heart disease and early death, right? 700 million. So when you start to think of it, we've not moved towards that system. What we've done is we've just cut costs and reduced the current system without any sensible transition. And maybe the Russians, because they actually had the Feldscher, the FAP points, the Feldscher-Accouché points, they might actually have the, with Zemstva medicine and the FAP points, they might actually have a tradition that actually is more rooted in the community than what we're dealing with, I think. They have more possibility.
Isn't that what you found in Tomsk, actually, when you were working with TB?
Yeah, I mean, that in Tomsk, we were surprised at the capacity because, they'd say, well, the Feldscher points are also understaffed and underfunded, right? So I'm not going to make this glory story about it, but they did have the capacity to deliver care, link up with the Russian Red Cross, do stuff in the communities. And I was really amazed by the capacity to reach from the oblast center to the rayon centers and then downward to the villages in a way that, is very hard to do. Now, that system has broken down as it's been defunded. So if anything, that's probably what we're seeing, just like we see in rural America. Rural American hospitals are probably going bankrupt because of COVID, many of them, unless they're bailed out. So we're seeing the same defunding system that took place here happening there. I mean, Josh, you're in Moscow, which is probably the best funded part of it, but you've obviously seen other parts of the country, and so you probably watched over time the system crumble a bit, right?
Absolutely. In fact, one of the articles that I reported that left the greatest impression on me was actually about a medical train, is the best way to describe it, that traveled among some of the most remote villages in the Russian Far East, because the state of medical care or the medical facilities had so deteriorated in these rural regions, or in fact, some of them never really was there to begin with. Villages that were created in during the expansion and laying the track of the BAM, so-called BAM train line, which runs north of the Trans-Siberian through some really remote territory in the Far East. And the Russian railways, along with the health ministry, put together this train that goes from village to village and offers some basic care. But I was struck, well, one, by the fact that such a train was needed, and two, when I got off the train in the villages and went to go see, okay, what's the clinic like in this town? It looked to me like scenes from a movie. I mean, a clinic from the 1950s, 60s at best, with equipment that certainly dated to that time. And that was just a few years ago. So, this was one of the more extreme regions. Not far from every region in Russia, needs a train filled with doctors and equipment to come through to provide care to patients. But I think it was a sign of, when you get out into some of the more remote areas in Russia, really, I think you're moving back in time effectively. And you may know this better than I do, but in Moscow, I feel like I have access to cutting edge medical care that is no worse or different than what would be available to me in the US in certain ways, just because of really insurance questions, and having private insurance in Russia actually gets you much farther than most insurance plans get you in America. I feel like I have access to sort of quicker and better care in Moscow. But I know that that's really a function of privilege, of having a private insurance plan and living in Russia's wealthiest city that receives an extraordinarily disproportionate amount of funding, and whose budget, is far outstrips any other Russian regions. There's no close second. So Moscow is able to provide a level of care that rivals most or all Western capitals, and we'll see how it fares with coronavirus. Moscow so far has about, I think, 2/3 of the cases. That's tapering off a bit, perhaps because Moscow has been in the most extreme form of lockdown for about 2 weeks now. Some of the other regions, as we alluded to in the opening comments, there's a bit of a hodgepodge approach here, where each governor, within certain limits, gets to decide or has decided how tight or not to make the quarantine. So perhaps one reason why we're seeing new infections go down in Moscow, and that the proportion of Moscow decrease is because Moscow has been on this quarantine. But nonetheless, so far, Moscow is leading with a number of cases. And perhaps, I don't know what you would say, Salmaan, if that holds, that's actually a good thing, if that's the right way of putting it. In other words, if this stays for Russia a Moscow-centered epidemic, then Russia has a better chance of seeing it through without the most kind of tragic or difficult outcome. If this gets out into the regions and ceases to be a Moscow epidemic, but the Moscow epidemic kind of slows due to the social distancing and quarantine measures, but explodes in places like Komi and elsewhere, then I think it's a whole different story and a much more difficult story. And perhaps that's already happening, and perhaps that's why Putin sounded so pessimistic and morose in his comments yesterday.
Well, just to pick up from that, Josh.
Oh, go ahead.
Sorry, Alexandra, go ahead.
No, go ahead, Tom.
I was just going to say, just to pick up on that, I would imagine what you're saying is probably going to happen, because we've seen that in the United States. You obviously have these very big epicenters like New York, but then you also have Louisiana, you have Boston, Massachusetts, you have other places that have cities that actually have high rates. I want to pick up on something you talked about, Russia's capacity to help people like any other state. We're seeing in Europe a different situation than the United States, right? So you're not seeing massive unemployment because they're using mechanisms to keep jobs, to fund employers to pay for jobs and things like that. And one of the things that I was impressed with as I was talking to friends in Moscow is that the Russians, using their existing system of pensions for the elderly, are able to give extra money for the elderly. They've set up systems of volunteers in Moscow to help deliver food to people who are under quarantine so that they don't have to leave. I understand there's some draconian things around that as well, but they're also facilitating quarantine and helping people do that better. And we've had a challenge doing that in the United States. We don't have those systems in place, right? You're told to quarantine and then you're just, somebody, your family or somebody has to help you, but there's no system to do it. I would love if you would comment on that, because I think if the Russians are in fact doing what I've heard, it's a really good thing. It will help.
Yeah, I'm afraid here I do have to take a more pessimistic tone and say the mood on the ground, this isn't just my mood, but what I'm capturing in my own reporting is much more pessimistic than that. In Moscow and around the country, people, especially people involved, say small business owners or even just employees of larger companies, are really dismayed by the lack of economic leadership and economic decisiveness from Putin and the federal government at large. There has been no kind of state of emergency or other kind of bureaucratic formulations called in Russia, which effectively means that people are told to stay at home, unfortunately, exactly in the way you described. What Putin has declared formally and legally are an extended series of now prolonged kind of working holidays in which companies are not allowed to fire their employees, but there's no actual stimulus plan or money from the government to help companies in doing that. So they're left in an impossible situation, especially if they're in any kind of service, retail, food industry that have zero or close to zero revenue. The government is offering them no help. It's telling their employees that they're on this kind of extended holiday in which they will be promised to be paid their full salaries, but no one is explaining or let alone providing the actual financial resources necessary to make that happen. So yes, there are these heartening stories of kind of volunteer initiatives. There's one in my stairwell, right, to kind of bring food when you go to the grocery store to bring food back for the few sort of elderly people or people otherwise who are at risk and shouldn't be going out. So there are volunteer initiatives, just like I understand all over in the US and elsewhere, that are filling in the cracks for where the government is not sort of acting in a very resolute or decisive or impactful way. But when definitely, I can say kind of without doubt or ambiguity, when it comes to the economic side of this, people in Russia are really wondering, where is the Kremlin? Where is the government response? There doesn't seem to be a lot of intervention, especially when it comes to small and medium-sized businesses, to explain to these people, your employees are going to sit home, your businesses are going to be shut, but here's how financially we're going to make that work for you. There's really been no effort or no initiative of that type so far.
I wonder if we could say that there's a contrast between kind of the limited economic leadership, as you characterize it, and what we might be seeing from the medical area or the field of public health. I mean, one of the problems that we've seen in the U.S. is that things are so decentralized, and the states have so much control and responsibility over what happens within their borders, that there's really efforts to coordinate at the federal level, such as they are, have not worked, and the states with capable governors are doing much better than the others. But Russia has quite a different system, right? They're much more centralized. There's a Ministry of Health. And I was wondering, Salmaan, if you could speak to the extent to which the ministry is able to actually compel things to happen on the ground in the regions. If that's actually power that they have, or because of the cuts in funding, if they actually can say what they want, but nothing really is reaching down to the ground level.
Well, our experience with TB has been that the ministry will make up precauz about certain guidelines and things, but then it really is up to the states to implement it, and it varies. So even in the area of tuberculosis, you have some states that are doing a very comprehensive approach and trying to do all the pieces of the epidemic control strategy right, and others that are not. So I almost see it as similar to the United States. You think of Russia, and especially, you would think, just to forget COVID, which is a national emergency, you would think of something like TB, that, well, the Russian government will say, do X, and then X will happen. But it's really like what the Centers for Disease Control do here. They give guidelines, and the states either follow it or they don't. The government there has more power in that they've got centralized procurement, and they can give things to the states to help make it happen, but then the states have their own procurement as well. So, I would imagine, and I've heard this from a colleague, that there is a hodgepodge of rules and regulations and things that are coming out from the different states, just like here. Some have a quarantine if you visit, some don't. And so you really, because I was asking a colleague, had she gone to our project in Vladimir, and she said, no, I haven't, because even if I take the 1.5 hour train, I'd have to quarantine for 14 days because Vladimir Oblast requires that. So, but other oblasts don't. And so, you really start to see that there is this hodgepodge. We always think of Russia as super centralized, and it probably is in many ways, but not in this. And the state budgets pay for most of the healthcare. And you see that because some of the states have reasonably good healthcare, and the poorer states, mostly as you go east, have very lower levels of healthcare, as Josh was describing. And so that again is indicative that it's not just some central system where everything is coming out.
So in that kind of situation, it's even more important that we have information coming from different sources on the ground. The Russian mediascape is pretty centralized, certainly when it comes to TV. And I wanted to ask you, Josh, what are you seeing in terms of good sources of information? Is social media, for example, in the regions getting information out that might otherwise not make it to the national level?
Sure. I think that in this case, in fact, there's so many aspects of this story, coronavirus brings out existing dynamics and really sort of sharpens them and gives them a really acute form in so many aspects of a country's national culture, its economy, and society. And when it comes to Russia and the media, I think that's all the more true. In other words, the dynamics that have been going on for a long time in Russia, especially in the Putin era, and changing after 2014, most especially as sort of state control became even stronger and reached into ever more media sources. All of those dynamics are now at play in the coronavirus epidemic, and how Russians understand what's happening in the country, the kind of information they have access to, and the kind of pressure that those outlets are under. There was a new law passed recently in Russia making it a crime to pass so-called fake news about coronavirus. Of course, there are worries, I think completely well-founded ones, that law will be deployed potentially indiscriminately, or rather, better to say, in a targeted way, right, against those news outlets that the government wants to target for political reasons, and those that are either part of the state media machine or seen as loyal to it won't find themselves coming under those sorts of charges. So I think that the difficult, at times almost impossible environment for independent media is going to come under even more pressure now. That said, there is nonetheless a perpetually embattled, perpetually pressured, but still existing and vibrant and quite skilled and competent independent media scene in Russia, with a number of outlets doing really important work, whether it's Meduza and Media Zona, to name some of the online projects, or a place like Novaya Gazeta, the long-standing newspaper, all of whom have done good and impactful, important reporting about coronavirus. But as you mentioned, just like everywhere else in Russia too, social media has in a way become the new form of media, especially actually in a place like Russia, where traditional media is under so much pressure, and there aren't a wide, diverse number of trustworthy, independent sources. People do turn to social media. And that's actually how I've done a lot of my reporting on coronavirus, using Instagram and Twitter, and trying to find people, whether they're patients, doctors, people maybe who live in a particular region or city where there's something going on that I want to understand. People are Russian social media like Contagious, Facebook is also extraordinarily popular here. So there's a big conversation around coronavirus, just like everywhere in the world, right? That's any country you go to, that seems to be the main national conversation these days. And that's happening in Russia, and it's happening in the same places it happens everywhere, on those social media platforms that I just named. And so if you have the time and inclination to sift through them, you really can get, albeit a sort of anecdotal picture of what's going on. But at a certain point, the amount, if you get enough data points, you do feel like you get a sense of what's going on. And as a reporting tool, if it's a kind of first point of contact to then follow up with the person and get even more detail, it can be quite fruitful. Of course, that shouldn't be, and it isn't, a replacement for a robust and healthy independent media scene, but that nonetheless, that's the reality that we're dealing with today in Russia.
Josh, can I push you on this a little bit? Because I'm interested in something going on in the United States, and maybe you can reflect on the Russia situation. We pride ourselves on having this inviolable constitution, which I have just the utmost respect for. I think it's one of the great documents of the last half millennium. And one of those things is the right to assemble, and in the First Amendment, the Fourth Amendment, the rights against illegal search and seizure, etc. I don't see in the American press any robust discussion of the fact that when people put out edicts that more than 10 people can't gather, or more than 50 people can't gather, does that violate? People were just like, well, it's a health emergency, so you can just suspend the Constitution. Or people talking about contact tracing devices that will say, oh, Salmaan was at Whole Foods and he was beside these 10 people. Let's get their names and phone numbers from the phone company and go track them, and their addresses. And you're like, oh my God, that's just like Fourth Amendment violation, par excellence. But people seem to be okay with that. And in fact, the governor of South Dakota, who refused to put in a lot of these edicts and said that in a robust democracy, you want to give people advice and they should follow it themselves, has been sort of mocked for that. So I just wonder, we haven't had a press coming together and saying, how do we nurture our vibrant democracy, have safety, public safety in an emergency, while still upholding these beliefs and these things that are so fundamental to our country? We don't have that. And I'm just wondering how you reflect on what's going on here with respect to what you're seeing in Russia. Because sure, emergencies in general are a chance for hawks to clamp down, take away rights,
the difference for the best. The difference that I would say, it's a bit hard for me to speak with such specificity to the US situation, because that's just not my journalistic beat, as it were, right? I actually end up, well, by virtue of my job and where I live, I can tell you with much more acute and fine-grained detail about what's happening in Russia around coronavirus, and not only than I can with the US. So it's hard for me to sort of compare apples to apples in that way. But it's interesting to hear what you say. And really, when I'm kind of reporting about and talking about now the kind of the way things are in Russia, I'm not necessarily making a comparative argument. I'm just explaining kind of, this is what's happening in Russia. I'm happy for you and people watching, others, to make those comparative connections themselves. I'm all in favor of that, but I'm just trying to, with as much fidelity as possible, explain what I understand is happening in Russia. But there is a few big differences, I think, between the Russian and the US case as concerns as this kind of drift toward potentially hemming in some rights in response to an emergency. The first is that this is nothing new in Putin's Russia, right? This isn't a unprecedented government response to the particulars of this emergency, right? We've seen for 20 years, if not more, especially going back to the Soviet period. But if we talk about kind of Putin's rule in Russia now 20 years old, right? There's been this perpetual drift, at times much more than a drift, really in kind of sped up, fast forward toward government control of independent spaces, whether it's media, civic activism, certainly any kind of independent opposition political activity outside of the Kremlin's remit or outside of its approval. So the measures we're seeing now are part of what really you could say is a kind of tradition at this point. After 20 years, I think that's long enough time to talk about a political culture with some habits and inclinations. And that political culture is by kind of default distrustful of any activity outside of its control and outside of its authority. So this emergency situation is being used to implement certain new measures, like, for example, this law against propagating so-called fake news about coronavirus, or as we're seeing in Moscow, where I live, the implementation of a so-called pass system, where residents actually have to download a government-created app and get a personal QR code if they want to travel around the city. So there are some new manifestations of this, but really it's an extension of a political culture that's pretty embedded into the way Russia has been ruled for the past 20 years. And that leads into the second aspect, which is there's therefore not a lot of trust about the state's intentions when it comes to why is it implementing these controls? What does it really want to do with that information? If you talk to lawyers, activists, digital privacy people here in Moscow, all of them are 100% sure that this digital pass system is not going to go away at the end of the coronavirus epidemic. It will exist at least in some form, perhaps now indefinitely, right? So there isn't a lot of faith in the kind of intentions or motives and the political leadership when they implement these kinds of controls and that are effectively authoritarian or display an authoritarian impulse, right? There just isn't a lot of social trust about why the authorities are doing that. Is it for public health reasons, or is it because the authorities have this default inclination toward control?
Although one of the interesting things about how the Russian state has responded to it is that they've been so good over the past 20 years about having a coherent narrative about what's happening in the country. And I haven't really seen that emerging now. I mean, you've had, for example, Putin is sort of giving the not so bad news, and then it's the locals like Mayor Sobyanin in Moscow who's in charge of telling people they can't leave their houses and can't walk their dogs past 100 meters from their houses. And it's been interesting to see that under enormous pressure from the virus, that there isn't this ability to pull together and to have the uniform state line about what's going on and how effectively the state is responding. Unlike in the US, where like not only is there no ability to have that kind of uniform narrative, but in fact, there is no public federal narrative about what's going on with coronavirus and what people should be doing.
Mm-hmm. Just like with the economic question, on the sort of overall kind of social political messaging side of things, Putin also has been noticeably absent, as you just alluded to, right? He hasn't taken the role that we so often ascribe to him as this kind of national leader, the man who likes to be photographed, shirtless on the horse, looking the strong man who has a solution to every problem. That's really not been the case here. He's been noticeably absent, or relatively absent. He hasn't given the kind of forceful, rousing, very clear speeches that someone like, say, Macron has given in France, who's used this as an opportunity to, among other things, kind of build up his political image or brand. And it's been quite telling and I think important in terms of understanding where we are in the chronology of Putinism, to see that Putin himself has not emerged as the strong, forceful leader in Russia's coronavirus response. He's taken a backseat to people like Sobyanin in Moscow. I feel like, as a resident of Moscow, the person who's kind of in charge of my local, coronavirus effort, I feel like I'm at Sobyanin's mercy, not Putin's. In other words, I feel like in Moscow, it's Sobyanin calling the shots, not Putin, which is an unexpected, I think, turn of events for Russia watching who are so used to talking about the so-called vertical of power, right? Putin's centralized hold on the country in which all decisions flow down from him. He may be making the ultimate decisions behind the scenes, but he's certainly not being the public face of the response. And that's both surprising and I think also an important data point to pay attention to.
Salmaan, I've been integrating a lot of the questions on Facebook into the comments that I've been making and the questions, but there's one we haven't got to, which goes back to what we mentioned at the beginning in terms of TB. The problem in Russia has been over the past couple decades significantly bigger than in most developing countries. And there are some questions about whether or not TB patients, or for that matter, HIV positive patients, are going to be more at risk of coronavirus, and whether there's a risk of these two epidemics being particularly dangerous in Russia, more so than they would be, say, in Europe or in the United States.
Well, let me just start with the HIV question. It seems that there doesn't seem to be an increased risk for people with HIV. Like some people suggest that there is, some people suggest that there isn't. So that one, I'm not certain about what to say about the HIV part. The TB part, people with TB are more prone to other lung infections in general, and and people with underlying lung conditions are more prone to coronavirus disease. So I think that there is that. In fact, our group is working on looking at how you can synergize testing for both, because in some communities, not in Russia, but in some communities, you actually have higher rates of TB than you would coronavirus. You're seeing in parts of Asia. So there is definitely a synergy between the two, and in fact, you could and should be testing for both at the same time, because the symptoms are the same: shortness of breath, fever, like feeling, all of these things are very similar. And so there is definitely a synergy between the two.
And
I know I'm not exactly answering your question because it's very hard to, the group that's getting TB in Russia is not this young crowd in Moscow that may be getting it. So it's just not an overlap of the groups. But if coronavirus were to enter the group that gets TB, they would be at higher risk.
And do you think that they'll be able to, that the Russian healthcare system will be able to maintain its treatment of TB throughout the crisis?
Well, so I was, one of the colleagues that I was in touch with that is the main doctor on our research project in Vladimir, she was telling me that they've been treating the TB patients. The system has been working. They've even been screening people for coronavirus and finding that in Vladimir city that they're not seeing the rates that Moscow's seeing. So, I think they're doing it. Now, again, what's the quality of the test? What are the false negatives, the false positives? There's lots of questions that one has. But I think as far as what the data they're collecting, they are continuing their TB work and screening and treatment, and also trying to, to make sure that this group doesn't have coronavirus.
So we're coming almost to the end of our hour, and then I wanted to ask if you have any closing thoughts to the question of how you're going to be judging the Russian reaction. In other words, what are you going to be keeping an eye on going forward to be able to assess if the Russian government, the Russian healthcare system is going to be able to meet this challenge? Josh, can I ask you first?
Yeah, I'll just return to something I spoke about in earlier remarks, which is, does this remain largely a Moscow phenomenon, or does it get out into the regions? I think there were some very worrying reports that I talked about in the beginning of my talk about the Moscow Health Department saying that the number of hospital beds they could reach capacity in 2 or 3 weeks. But at the same time, they're building new coronavirus hospitals or kind of reformatting existing hospitals with amazing speed, kind of like we saw in China and elsewhere. A new hospital being built from scratch in a matter of weeks. And so I think that with the resources of Moscow, and Moscow being so important politically and just its wealth and economic power, I think that Moscow can deal with even a kind of even a more, not necessarily extreme, but kind of with one of the outer kind of versions of how this epidemic plays out in Moscow. I think the city of Moscow can handle it. I don't think some of the other regions, whether it's Komi, small towns in the Urals, Siberia, the Far East, I'm not sure that they are equipped to handle. They just simply don't have the facilities. They don't have the dedicated facilities to separate coronavirus patients from other patients. And they also, frankly, don't have the economic wherewithal to survive weeks of quarantine. And that gets back to the economic question we talked about before. With no large federal aid coming from Moscow, quarantine is simply a privilege or a luxury that the regions can't afford. Their economies can't afford shutting down for weeks. It's difficult to do in Moscow without financial support for small and medium-sized business owners, and even large companies that are having to go somehow not lay off people but not get revenue. But it really becomes difficult in the region. So for lots of regions, this will be a whole different story and a much kind of darker and more tragic story if this expands with any scale or size into the regions. And so therefore that'll be the question that not the only question, but perhaps the chief question I'm going to be looking at in the coming weeks.
And you, Salmaan?
Yeah, so I am looking at a couple of different things. One is, I want to see how Russia leverages its TB programs and other programs that are already working in the community. They have the benefit of having pretty well in every oblast a system that can reach people in the community. Some more robust than others, but they all exist. Are they able to really expand on this and leverage this? And just like we're talking about, will the pass system exist? With the QR codes exist after COVID? It'd be really amazing if building up the extension of the clinic into the communities where patients live and work extends beyond COVID to help Russia with diabetes and a lot of other things. So really, how can they leverage their existing systems that could help COVID testing and treatment? That would be one. Then the other thing is, Russia's got an incredible scientific establishment, and they've always had these TB institutes and other infectious disease institutes, and a number of them have now merged and become amalgamated, like in Moscow. And I guess the question I have is, when we're looking at rates in Russia, one of the theories why their rates might be lower than other countries is because Russia is a big user of BCG vaccine for TB, and BCG protects young kids from TB and gives 50% protection from TB. And one of the ways it works is that it's just a general immune booster. And there's lots that has shown that BCG actually helps with a lot of upper respiratory infections. So you could imagine that the Russian scientific establishment should be looking at these things, should be looking at more widespread use of UV lighting, should be actually doing more community-based surveys to figure out what's going on in the different regions, should be actually doing research on vaccine and preventive therapies and stuff. Because again, Russia is the kind of country that if they directed their scientific establishment to work on these things over the next 12 weeks or 24 weeks or 48 weeks, you really could get a lot of solutions. So I'm also going to be looking to that leadership, that scientific leadership coming from Russia, because they have the potential to do that.
Thank you. Thank you both. We've been talking with Salmaan Keshavjee, a professor at Harvard's Medical School and director of the Medical School Center for Global Health Delivery. He's also a physician at Brigham and Women's Hospital in Boston. And Joshua Yaffa is the New Yorker correspondent based in Moscow and author of the recently issued book, Between Two Fires, Truth, Ambition, and Compromise in Putin's Russia. We didn't cover all of the issues that we could have. I hope that you'll come back and talk to us sometime soon. And we're going to be dealing with some of the political issues that we didn't get to on Friday with Professor Timothy Colton and Evgenia Albats, a journalist from the New Times in Moscow. So please tune in on Friday. And Salmaan and Josh, thank you so much for joining us today.
Thank you, Alexandra.